Today we're going to discuss proper draping techniques as well as proper eye, lip, and full face, neck, shoulder, and décolleté cleansing, followed by massage. So I'm going to begin by placing a protective towel across the client's chest. In this case, you want to make sure that your tag is away from the client so it doesn't cause any irritation, and that you take about 1 inch to 1.5 inches of your towel and tuck it right underneath their robe, so that it stays nice and tacked and in place. The first thing I'm going to do is begin by washing my hands prior to touching the client. Okay, after checking the client's health history card and looking for any contraindications to product allergies, we'll then commence with our So our next step is to take 5 cotton pads, just slightly beveled, so that it's easier to separate. And you're going to take the pads and you're going to dip them into fresh water. Placing them in the palm of your hand, you're going to squeeze out the excess water. Using your towel, you're going to pat your hands dry, and you're going to separate your cotton now into 5. The first 2, we're going to place our eye makeup remover on. So you can use the Jean Darcel eye makeup remover, specifically designed for the eyes. It separates, so it's important that you shake it first. And you can dispense that onto your 2 cotton pads. Your other option for eye makeup remover is the rosemary cleansing milk. On our second cotton, you're going to place a gentle skin cleanser for the lips, and you need a very small amount. And then on our final 2 cotton, we're going to apply our facial toner. And you just want your cotton to be slightly moist with the water prior to applying your toner. Beginning with our eye cleansing, our first step is to first come in contact with the client so that they're aware that you're present. And then you're going to place both cotton pads on the eyes, and you're just going to hold them for approximately 10 seconds. This helps to dissolve the makeup that they're currently wearing. Then gripping them with your thumbs and your fingers on top, you're going to work 3 circular movements around the eyes, coming up and back underneath. After your 3rd movement, you're going to bend your elbows out and you're going to drag the cotton across the lashes and off the eyes, keeping in contact with one hand. With the other hand, you're going to fold your cotton in half, dirty side in, place it at the start of the brow, followed by the other cotton. Now we're going to perform 3 strokes simultaneously, down the inner corner of the eye, down the center of the eye, and the outer corner of the eye, working from right underneath the brow, off the lashes. And we'll perform this movement twice. From here, we're going to take our left hand, supporting the right brow. We're going to take our cotton pad now and flip it over so we have another clean side. And I'm going to ask our model to look up. And we're going to clean any eyeliner and mascara from the lower lid, working from the outer corner to the inner corner of the eye. When that's complete, this cotton can go into the garbage. We're now going to place our right hand at the left eye, flipping our cotton over, asking the client to look up, and we'll sweep again from the outer corner to the inner corner. It's important you ask the client if they're wearing contact lenses prior to your eye makeup remover. From here, we're going to prepare 2 cotton pads, 2 Q-tips, And we're going to dip them into a small amount of our eye makeup remover. And supporting the left eye using the right hand, we're going to travel off the lashes, rolling against the lashes to pick up any residue. And we're going to slide along the lash line to remove any traces of eyeliner. Having the model look up, we're now going to support the corner of the eye and keeping the Q-tip nice and flat, not poking the eye. So keeping it nice and flat, you're just going to drag gently from the outer corner of the eye to the inner corner of the eye until all makeup residue has been removed. Proceeding on to the other eye, we'll support the left eye with the right hand, and now we'll work with the left hand. This is important to improve your dexterity with your opposite hand so that when you go into massage movements, you're working with equal pressure on both hands. And have the client look up, slide in underneath the lash line. It's also important that you choose a new Q-tip for the second eye and never use the same Q-tip from one eye to the other so that there's no risk of transporting any bacteria or infection. Now taking your lip cotton with your product, you're going to work the product into the cotton pad so that none of it goes into the client's lips. Then you're going to fold the cotton in half with the product side out, supporting the left corner of the lip. Holding the cotton properly in your hand, you're going to sweep across the upper lip and across the lower lip. Now taking that cotton pad, you're going to turn it over using the clean side. Again, you're going to switch hands, so now support the right corner of the lip. With the left hand, you're going to sweep across the upper lip and across the lower lip. If there's any makeup residue left, you can fold your cotton into a quarter so you have another clean side, and you can continue this practice until the lips are clean. Taking the cleanser from your palette, you're going to dispense all that you've taken into the palm of your hand. And you're going to warm that cleanser up in your palms. Your first 4 steps have to do with spreading the cleanser. We're going to start by clasping our hands, touching the client's headband with our arms so that they know we're present, and with your fingers clasped, you're coming across the neck, slide in over the jaw, clasp your fingers again, travel out along the mandible, back in to the cheeks. We're going to come across the cheeks, across the zygomatic, down under the eyes, around the nose. When you come up onto the forehead, you'll have product up on your upper palm, so you're going to do a gentle wiping that will feel like a stroke to the client. You're going to come around the eyes, fingers pointing downward. You're now going to place your hands flat and come off the chest. From here, you're bringing your hands to the center, and starting at the décolleté, you're performing nice slow circular movements to the tips of the shoulders. Return and repeat it again, keeping your hands nice and flat, and one more time. When you reach the shoulder tips, your right hand will come across to the left shoulder, and you're going to perform 10 movements with your hands flat, up over the décolleté and the neck, and whatever the right hand does, the left hand will follow. Then placing your hands at the center of the neck, you're going to perform large circular movements up over the neck and the under portion of the chin. From here, you're going to glide up, and using your middle and ring finger, You're going to perform small circular movements from the chin to the upper lip, returning back to the chin. And now you're going to perform large circular movements in a figure eight from underneath the chin, around to the crest of the chin and around the upper lip. And you'll return back again in another figure eight. The chin, the upper lip, chin, and under. From here, you're returning to above the mandible bone, and you're going to perform small circular movements above the mandible bone to the base of the ear. You're going to return to the corners of the lips and perform small circular movements to the middle of the ear. And then you're going to return to the corners of the nose and perform small circular movements towards the temples. And return and repeat it. Now you're going to slide in underneath the eyes, and you're going to work around the nose 3 times. It's important you come up and off the tip. If you go the other way, you're going to get product in the nostrils. Then using your middle finger, you're going to work the nasolabial folds, which is the line that runs from the nose to the lips. And then you're going to travel up the bridge of the nose, and you're going to circle around the eyes 3 times. On your 3rd time, you're coming up the bridge of the nose again, and you're performing circular movements with the finger pads over the forehead. When you reach the temple, you'll slide back in underneath the eyes, up the bridge, and repeat it. Then you're going to end by bringing your index finger and your ring finger to the starting point of the brow, and you're going to apply pressure and hold for 3. And then glide across the brow to the temples and apply pressure, hold for 3. And then slide down off the side of the face, off the neck, and off the tips of the shoulders. Now we're going to start the cleansing removal process. You would normally be using sponges, but I'm going to use gauze to demonstrate what it would look like in clinic where you can't use sponges. So I'm going to take the 2 gauze, and I'm going to place them in hot water. I'm going to squeeze out the excess. Make sure your hands are not dripping, so you want to dry them on your towel. And then taking your gauze, you can fold back about 1 inch or 2 centimeters of the top to add a little bit more padding if you prefer. And whether you're using sponges or gauze, you're going to secure them with your baby finger and your index finger. Starting at the neck area, with your right hand on the left shoulder tip, you're going to start with your 10 movements or strokes up the neck. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Placing your right hand underneath the chin, followed by your left hand. You're going to do a nice clean sweep underneath the mandible to the earlobe. From here, you're going to place your sponges or gauze on the tip of the chin and travel along the mandible to the earlobe. Return back one hand followed by the other, so you're not losing contact, from the corners of the lips to the middle of the ear, and return one hand to the side of the nose followed by the other towards the temples. From here, you're going to place your sponges or your cotton underneath the chin, come around to the tip of the chin, around the chin to the upper lip, come around the nose a couple times, come up the forehead, and with your sponges flat, you're going to do a nice clean sweep across the forehead, down the hairline, and off. I'm going to wash out my gauze, and we'll repeat that step one more time. Resetting my gauze, I'm going to let the client know I'm present by touching their headband and begin again. And this step should be repeated as many times as you feel necessary in order to get all makeup and debris off of the skin. Following your cleansing routine, you'll then proceed with your pre-moistened cotton pads with your toner, and you'll follow the exact same removal steps for your cleanser with your toner. It's important at this stage now to take a tissue, fold it into a diamond, and you want to pat the skin dry. And for the neck and shoulder and décolleté area, which is a little bit larger, you can bring your towel up from their chest and gently drape it across the area and just pat to absorb any excess moisture.